Hello, I'm Superintendent Brian McDonald. With new developments locally, I want to let you know about the steps we've taken to prevent the spread of the coronavirus in our community. We're staying in close and ongoing communication with the public health experts at the Pasadena Public Health Department, County Office of Education, and the LA County Department of Public Health. And we are working in collaboration with the Board of Education to monitor the latest developments about COVID-19, provide accurate information to our communities, and keep our students, teachers, and staff safe and healthy. PUSD has been proactively planning for the different scenarios that can develop to protect our students, staff, families, and community members, and we are taking precautionary measures to help prevent the spread of coronavirus in our school community. Our first priority is the health and safety of PUSD students, faculty, staff, and community members, including those who may have a greater risk of complications from COVID-19. Our schools are reviewing hand-washing protocols with students and allowing for breaks so that students can wash their hands. We are cleaning surfaces and objects that are touched often, such as bathrooms, countertops, doorknobs, and faucet handles. Schools remain open. The Public Health Department of Pasadena and LA County will work with us to assess and determine on a case-by-case basis if a school needs to dismiss or close. The precautions to avoid exposure to coronavirus are the same precautions you should take to avoid the flu. Ann Rector, the Director of PUSD Health Programs, will tell you more.
Stay home and away from others if you have a mild illness, with a fever of 100 degrees or above. Number one prevention method is frequent hand washing with soap and water for 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not available, hand sanitizer with at least 60% alcohol can be used. Use of soap and water is best. Cover your cough or sneeze with a tissue, then throw away the tissue in the trash can and wash your hands. If you do not have a tissue, use your sleeve, not your hands, and wash your hands. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact, like kissing and sharing cups or utensils with people who are sick. Clean and disinfect frequently touched objects and surfaces. Face masks are most effective when used appropriately by healthcare workers and people who are sick. Get the flu vaccine if you have not done so this season. It's not too late to get the flu vaccine. Being protected against the flu will decrease the number of people using our healthcare resources and allow resources to be available for people who may have COVID-19.
We are sending a message out to you outlining the specific steps we're taking to protect our students, staff, families, and community members. The message, along with the most recent information about PUSD's response to COVID-19, is posted on our website at pusd.us. Thank you for your support and understanding as we all work through this evolving situation.